Chapter 20, Antineoplastic drugs. Here are your objectives for this chapter. This is a short one. So the use of antineoplastic agents, we'll be going over that, the mechanisms of action, classification, adverse drug effects, combinations, and dental implications. Antineoplastic drugs were designed to treat malignancies. They may also be used for the treatment of diseases with an inflammatory component such as psoriasis, rheumatoid arthritis, and systemic lupus erythematosus. The dental health care worker should be aware of the timing of treatments with antineoplastic agents and the effect on bone marrow. The dental health care worker should be familiar with the side effects of these agents, including their oral manifestations. Rapidly growing tissues are most susceptible to the antineoplastic agents. That's important to know, highlight that. They consist of hair follicles, bone marrow, and the gastrointestinal tract. So the antineoplastic agents may be used alone or in combination or with radiation or surgery. The efficacy of antineoplastic agents is based primarily on their ability to interfere with the metabolism or the reproductive cycle of tumor cells, thereby destroying them. So you remember from biology, there are 4 stages in the cell cycle that include the G1 phase, or the post-mitotic or pre-DNA synthesis phase, the S phase, the period of DNA synthesis, the G2 phase, which is the pre-mitotic or post-DNA synthesis phase, or the M phase, period of mitosis. Most antineoplastic agents are labeled as cell cycle specific and are effective only at certain phases of cell growth. The cell cycle non-specific agents are effective at all stages of the cell cycle. So I have put a link in the folder where you receive this PowerPoint that you're following along. I want you to go ahead and click on that, and it will have it'll lead you to Khan's Academy, and he'll walk you through the actual phase of the cell cycle. So it's pretty interesting, and it'll keep you on track with what we're talking about. So resistance to chemotherapy occurs by either de novo resistance, in which the neoplasm was always resistant to the chemotherapy agents, or by acquired resistance, in which resistance occurs through natural selection of mutations. Antineoplastic agents are divided into groups depending on their mechanism and site of action. You can review this box on 23-2, which is actually the page number is not correct here, but you can take a look at the box where this is housed in your book. So the alkylating agents contain the alkyl radicals that react with the DNA in all cycles of the cell to prevent reproduction. You need to really highlight this. The antimetabolites, such as the methotrexate, attack cells in the S period, which is the DNA synthesis, if you can remember, of reproduction by interfering with the purine or the pyrimidine synthesis. They are more effective on rapidly proliferating neoplasms. Plant alkaloids are mitotic inhibitors and arrest cells in metaphase. Because of their low bone marrow toxicity, they're often used in combination with other agents with more bone marrow toxicity. Antibiotics are cell cycle nonspecific and are effective for solid tumors. Hormones such as prednisone interrupt the cell cycle at the G stage. Steroids are used to suppress lymphocytes in leukemias and lymphomas and in combination therapies. Estrogens are used palliatively in inoperative breast cancer. Tamoxifen, you need to know all about tamoxifen. It's an anti-estrogenic substance, and it's used to manage breast cancer and to prevent breast cancer in women who have a high risk for breast cancer. The cisplatin, it's a heavy metal complex of platinum, is cell cycle nonspecific. Hydroxyurea inhibits the ribonucleotide reductase, which interfere with the RNA synthesis. Procarbazine produces chromosomal breakage. Rapidly growing cells are more susceptible to inhibition or destruction by antineoplastic agents. The most serious difficulty encountered in antineoplastic therapy stems from the lack of selectivity between tumor tissue and normal tissue. For this reason, certain normal tissues are also destroyed, resulting in adverse effects. Bone marrow is suppressed because it is a tissue that is rapidly turning over. Inhibition results in leukopenia or granulocytosis, thrombocytopenia, and anemia. Symptoms may include susceptibility to infection, bleeding, and fatigue. Osteonecrosis is a recently recognized adverse effect of bisphosphonates, which work by binding tightly to the bone directly beneath the bone cells known as osteoclasts that actively dissolve bone. The binding of bisphosphonates to the osteoclasts prevents the dissolving of the bone. This allows the bone production to continue and bone density to improve and reduces the incidence of bone fractures. So, bisphosphonate-related osteonecrosis. This is also important for you to know. This slide is very important. So the incidence are much lower in patients taking oral bisphosphonates for osteoporosis. So your patient that comes in and is taking a tablet daily, they're not likely to, they haven't increased their risk too much with this problem. You need to know that bisphosphonates-related osteonecrosis of the jaw, also known as, actually the acronym is BRONJ, is an area of bone that has been exposed in the mouth for more than 8 weeks due to a bisphosphonate. You also need to know bisphosphonate-related osteonecrosis of the jaw is most likely to occur after a tooth extraction. Maintenance, oral health examinations, and any other dental procedure should be performed before starting bisphosphonate therapy or within 3 months of beginning therapy if possible. Okay, so we're getting into the adverse effects of antineoplastic agents. The sloughing of the GI mucosa, so the gastrointestinal mucosa, can produce many symptoms that include nausea, stomatitis, oral ulcerations, vomiting, and hemorrhagic diarrhea. Dermatologic effects vary from mild erythema and maculopapular eruptions to exfoliative dermatitis and Stevens-Johnson syndrome. Alopecia is frequent, but hair does usually regrow. So you need to know about the prochlorperazine or the compazine. It is a phenothiazine with marked antiemetic activity. You need to know about that drug. Liver problems occur primarily with antimetabolites such as methotrexate. You need to know that no neurologic adverse effect, okay? Liver problems occur primarily with antimetabolites such as the methotrexate. Neurologic effects such as peripheral neuropathy, ileus, inappropriate antidiuretic hormone secretion, and convulsions have been associated primarily with the vincristine or vinblastine administration. Renal tubular impairment occurring secondary to hyperuricemia is caused by rapid cell destruction and release of nucleotides. The treatment of leukemias and lymphomas often results in rapid tumor destruction with a consequent high uric acid level. Allopurinol is used in the management of gout. You need to know that because the antineoplastic agents have an immunosuppressant effect, enhancing susceptibility to infection, or a second malignancy may occur after treatment. Inhibition of spermatogenesis and oogenesis is frequent, at least temporarily. Mutations with the germ cells may occur, and the menstrual cycle may be inhibited. So oral effects include, of course, oral effects are important here, include discomfort, sensitivity of the teeth and gums, mucosal pain, ulceration, and gingival hemorrhage, dryness, and impaired taste sensation. Infection of oral mucosa from leukopenia and bleeding from thrombocytopenia can occur. So patients may experience inflammation of the mouth, xerostomia, or glossitis. Dental patients who are to take cancer chemotherapy agents should optimize their oral health before antineoplastic agents are even begun. So if oral hygiene or dental procedures are to be performed on a patient who is taking antineoplastic agents, the procedure should be planned to coincide with the presence of the highest level of formed blood elements. This time frame would be either just before treatment or on the first few days of treatment. After a cycle of drugs is completed, the effect on the bone marrow increases until the maximum effect is obtained. During this time, dental treatment should be avoided. The white blood cell count is too low and the chance of infection is too great. So patients receiving cancer chemotherapeutic drugs must be treated carefully. Mouth sores on the soft tissue of the tongue and inside the mouth, the oral mucositis, is a possible intraoral manifestation as a consequence of chemotherapy for cancer. Oral rinse of the 2% viscous lidocaine, highlight that. Oral rinse of 2% viscous lidocaine is a treatment option that helps alleviate symptoms. Any questions? You can reach out to me.